This is the Cultural Diversity Project presentation on India by Caitlin Krogan, Derek Sharp, and Marianne Wilson. India is a country that has a very rich culture. It is also known for its brightly colored fabrics and strong scents. India is also well known for its meditations and variety of spiritual views. The Indian people are warm and welcoming and always try to see the positive. Namaste, a common Hindi greeting, means I bow to the divinity within you. The greeting conveys their sense of humility and acceptance of all people. With this in mind, there are some strong cultural differences that you will want to be mindful of when working with the Indian population. Indians are generally a little more laid back with their sense of time. Punctuality is not always an important factor in their lives. On the other hand, showing respect is very important in the Indian culture, especially showing respect for someone that is seen as an authority figure. For this reason, you will usually be able to count on them making most appointments, even if they are late. Also dealing with respect, the relationship that you build with an Indian client will be very important to them. In India, meetings usually begin with idle conversation and business is conducted much later. This culture also does not like to answer negatively, such as no. This can be seen as being disrespectful, and oftentimes they will offer an alternative option. More commonly, they will tell you what they think you want to hear. As most cultures, it is important to understand that not every person inside the culture is the same. India is a country that has very different religions that have strong beliefs about what they can eat and how they dress. The cow is worshipped by the Hindu people. In India, traffic can come to a complete halt for several minutes to wait for a cow to move out of the way. They are also commonly seen roaming around as they please, including inside stores and temples. As you might guess, for this reason, the Hindu people do not eat beef. You should also avoid giving them gifts that include leather. On the other hand, the Muslim religion does not eat pork or consume alcohol. They also do not use products such as some perfumes that contain alcoholic elements. When working with the Indian population, there are a few behaviors to be mindful of. Public displays of affection are severely frowned upon and are punishable by law. This may affect an Indian patient's comfort level with contact during therapy or their comfort level with discussing relational occupations. On the other hand, it is common for one to hold hands with someone of the same gender to show that you are friends. You will also want to be mindful of the use of your hands. In India, the left hand is used for washing oneself after using the restroom. Therefore, the left hand is viewed as being unclean. Avoid using the left hand for any formal greetings or unnecessary contact. Shoes are also viewed as being unclean, as the streets of India are littered with trash and all manner of unclean things. For this reason, it is customary to take off your shoes when you enter someone's home.
All right. Similar to the United States, the number one cause of death in India is heart disease. The second leading cause of death is pulmonary disease, followed by stroke and diarrheal disease. Health problems prevalent among Indians include cardiovascular disease, hypertension, leprosy, high infant mortality rate, cancer, diabetes, tuberculosis, malaria, sickle cell disease, and dental diseases. Many Indian individuals believe in the traditional Indian system of medicine called Ayurvedic medicine. This medicine is derived from words Ara, meaning life, and Veda, meaning knowledge. It is used to help physical, spiritual, and emotional well-being. Ayurveda is focused on the connection with the universe and has 5 main components: space, air, fire, water, and earth. Depending on your personal characteristics, you are considered either a Vata, Pitta, or Kapha. Vata has qualities reflecting on the elements of space and air. Pitta has elements of fire and earth, and Kapha has elements of water and earth. Good health is achieved when your mind, body, and spirit are in harmony with the universe. A disruption of this harmony can lead to poor health and sickness. Therefore, depending on the different combinations of Vata, Pitta, and Kapha an individual has, determines the specific lifestyle and nutritional guidelines. Some things to consider while treating a patient. Modesty is highly valued among the Indian culture, and patients will typically feel more comfortable with a healthcare provider that is of the same sex. Women may feel uncomfortable in gowns that are perceived as too short. because they must always have their shoulders and legs covered. Direct eye contact from women to men may be limited, and mental illness is a stigma and may be suppressed. Indian culture is very family-oriented, and commonly, family members are involved in appointments. During inpatient stays, family members may want to be present and stay with the hospitalized person. Patients will often be happier to have frequent guests instead of feeling tired after visitors. Indian culture, they expect healthcare providers to have all the answers, so will commonly take a passive role, not asking questions and waiting for the practitioner's diagnosis and recommendations. They may view the practitioners as incompetent if they do not have a cure or way to improve the issue. Unless it is medically necessary, do not remove the sacred thread from the body. This sacred thread is worn on the left shoulder and across the neck. It symbolizes the person's official acceptance into their vana or class. As mentioned earlier, it is important to take into consideration the dietary preferences of Indian patients while they are staying in the hospital. Some may have specific restrictions such as no pork, no beef, or maybe fasting, all of which need to be accommodated for.
Power and privilege. The Indian caste system is historically one of the main dimensions where people in India are socially differentiated through class, religion, region, tribe, gender, and language. It is the sole basis of systematic ranking and unequal access to valued resources like wealth, income, power, and prestige. There are limits on interaction and in behavior with people from another social status. Leadership positions in society are monopolized by a few dominant castes. The two upper castes are ritually considered as superior to the lower castes. India is a male-dominated society where women are often seen as subordinate and inferior to men. Even though India is moving away from the male-dominated culture, discrimination is still highly visible in rural as well as in urban areas throughout all castes of society. While women are guaranteed equality under the Constitution, legal protection has a limited effect where patriarchal traditions prevail. The Indian Constitution grants women equal rights to men, but strong patriarchal traditions persist in many different societal parts, with women's lives shaped by customs that are centuries old. In these castes, daughters are often regarded as a liability and conditioned to believe that they are inferior and subordinate to men, whereas sons might be idolized and celebrated. In rural areas, women plow fields and harvest crops. Women weave and make handicrafts while working in household industries, sell food and gather wood while working in the informal sector. Additionally, women are responsible for the daily household chores, cooking, fetching water, and looking after children. Although the cultural restrictions women face are changing, women are still not as free as men to participate in the formal economy. The extent of discrimination against women also varies from one societal caste to another and from state to state, some areas in India being historically more inclined to gender bias than others. Primary education in India is not universal and oftentimes not seen as really as necessary for girls. Their parents might consider it more important that they learn domestic chores as they will need to perform them for their future husbands and in-laws. As a child, girls are often treated differently from male children in terms of nutrition and healthcare. Where limited food or financial resources are available, the insufficient means are prone to be allocated unevenly in favor of the male offspring. This imbalance results in insufficient care afforded to girls and women. There is mainly a bias towards men and their superiority in marital relationships. Women's happiness is vital for the prosperity, peace, and happiness of the whole family. At the same time, they should also be kept under constant vigilance since they cannot be completely trusted or left to themselves. There is a shifting paradigm in India where equality in marriage may be seen among younger married couples, but traditional roles are still prevalent in older married people. That is the conclusion of our India presentation. Thank you so much for listening and watching.